5 years ago, mesothelioma patients had essentially one treatment option: chemotherapy or a combination of chemotherapy, surgery, and radiation therapy. But immunotherapy has fundamentally changed the treatment landscape, giving patients new hope and, in many cases, significantly longer survival. Is immunotherapy truly a breakthrough, or is it just incremental progress? Today, I want to give you the real evidence about immunotherapy for mesothelioma, what it can do, what it can't do, and why it represents genuine hope for patients. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice, but I'm going to walk you through what the data shows about immunotherapy. Let's start with what immunotherapy actually is, because understanding the mechanism helps explain why it's different from traditional treatments. Your immune system is designed to identify and destroy foreign invaders and abnormal cells, including cancer cells. But cancer cells are sneaky. They develop ways to hide from the immune system or to suppress immune responses. Immunotherapy drugs work by essentially unmasking cancer cells so the immune system can recognize and attack them, or by removing the brakes on immune responses. For mesothelioma, the most important immunotherapy drugs are checkpoint inhibitors. These are medications that block proteins that cancer cells use to evade immune detection. The breakthrough moment for mesothelioma immunotherapy came with the CheckMate 743 trial results. This large, randomized trial compared dual immunotherapy of nivolumab and ipilimumab to standard chemotherapy in patients with pleural mesothelioma who had not been previously treated. The results were significant. Patients who received immunotherapy had a median overall survival of 18.1 months compared to 14.1 months with chemotherapy. That's a 4-month improvement in median survival. 4 months might not sound dramatic, but in the world of mesothelioma treatment, it's meaningful progress. What's even more important than the median survival is what's known as the tail end of the survival curve. Some patients on immunotherapy are living much longer than anyone expected. While median survival was 18 months, meaning half the patients live longer than that, some patients are living 2 years, 3 years, or more. In a subset of patients, we're seeing durable responses. That means the cancer is controlled for extended periods. Based on these results, the FDA approved the combination of nivolumab and ipilimumab for pleural mesothelioma back in 2020. This wasn't just for compassionate use or last resort treatment. It became a first-line treatment option, so doctors can offer it right from the start. More recently, based on the IND 227 trial, in September 2024, the FDA approved another immunotherapy combination, pembrolizumab combined with pemetrexed and platinum-based chemotherapy. This combination has shown a 62% response rate. That means 62% of patients saw their tumors shrink. Only 4% experienced immediate disease progression. Now, a 62% response rate is very impressive for mesothelioma. It represents real tumor shrinkage that translates to symptom improvement and longer survival. For patients with symptomatic disease who need rapid tumor control, this combination offers real hope. So, is immunotherapy a breakthrough? Let's look at the evidence for and against that characterization. Arguments that it is a breakthrough: it's the first new treatment class for mesothelioma in decades. Before immunotherapy, we had chemotherapy, surgery, and radiation, but no fundamentally new approaches. It provides better outcomes than previous standard treatment in head-to-head trials. It offers hope for durable, long-term responses that we weren't seeing with chemotherapy alone, and some patients have exceptional responses, living years beyond what would have been expected. Now, the arguments that it's just incremental progress rather than a breakthrough, the median survival improvement is measured in months, not years. And not all patients respond. In fact, a significant portion don't benefit. We still do not have a cure. Many patients still progress within the first year despite immunotherapy treatment, so we can't predict who will have exceptional responses versus who won't benefit at all. Now, I want to take a little break here for just a second to ask you a favor. If you're finding the information in this video helpful, please hit the like and subscribe buttons. It really helps us get seen by more people. And if you have questions you'd like answered or a topic you'd like covered in a future video, send me a note in the comment section. And make sure you watch this video until the end, because I'm going to give you information about accessing help and resources. Now, as for me, my assessment, based on the data and the patient outcomes I've read about, is that immunotherapy is absolutely a breakthrough for mesothelioma, even if it isn't a cure. Here's why. For the first time in decades, we have treatment options that work through completely different mechanisms. We're seeing some patients achieve long-term disease control that approaches what we might consider a functional cure, even if we don't use that word. The combination of immunotherapy with chemotherapy is showing response rates we've never seen before in mesothelioma. And perhaps most importantly, immunotherapy has opened the door to further innovation. Researchers are now studying immunotherapy combined with other treatments, immunotherapy in earlier stages of disease, different immunotherapy combinations, and biomarkers to predict who will respond best. The approval of these drugs has energized mesothelioma research in a way we haven't seen before. But we still need to be realistic about what immunotherapy can and cannot do. It can't cure mesothelioma in most patients. It doesn't work for everyone. Response rates are in the 40 to 60% range depending on the combination used, which conversely means that 40 to 60% of patients don't respond adequately. Side effects, they can be significant. Immunotherapy causes different side effects than chemotherapy, including immune-related problems like colitis, hepatitis, or pneumonitis that require careful monitoring and management. Plus, cost is a factor. Immunotherapy drugs are extremely expensive, often $10,000 or more per infusion. Insurance usually covers these FDA-approved treatments, but patients need to understand the potential financial implications. Who benefits most from immunotherapy? The data shows that patients with non-epithelioid mesothelioma, that's either sarcomatoid or biphasic types, they are the ones that get the strongest benefits from dual immunotherapy. Interestingly, these are the subtypes that historically had the worst prognoses, so seeing better outcomes in this group is especially encouraging. Patients who haven't received prior treatment tend to respond better than those who've already had chemotherapy, and patients in reasonable overall health who can tolerate treatment do better. What we still don't know, we can't reliably predict before treatment who will have exceptional responses versus who won't. We're working on identifying biomarkers, measurable indicators that might predict response, but we're not there yet. We don't know whether starting with immunotherapy versus chemotherapy first is better or whether the sequence matters. We don't know the optimal duration of immunotherapy treatment. That means how long patients should continue on the medication if they're responding. For peritoneal mesothelioma specifically, immunotherapy's role is a lot less clear. The dramatic results we've seen with cytoreductive surgery and HIPEC for peritoneal disease mean that combination remains the clear first choice for eligible patients. Immunotherapy may have a role for patients who can't have surgery or whose disease progresses after surgery. We just have less data for the peritoneal mesothelioma population. What should mesothelioma patients know about immunotherapy? First, it's now a standard treatment option. It's not experimental any longer. You should discuss it with your oncologist as part of your treatment planning. Second, both dual immunotherapy alone and immunotherapy combined with chemotherapy are options. Deciding which one is better for you, that's going to depend on your specific situation. How aggressive your disease has been, what your symptoms are, your overall health, and your treatment goals. Finally, immunotherapy isn't a magical bullet, but it does genuinely improve outcomes for many patients. You need to remember that side effects are different from chemotherapy. You need to understand what to watch out for and report what you experience to your team. So is immunotherapy a breakthrough for mesothelioma? Yes. It's the first new treatment class in decades. It improves survival compared to previous standards. It offers hope of durable responses, and it's energizing research for future advances. Is it a cure? No, and it doesn't work for everyone, but it does mean that we're making meaningful progress. If you're facing mesothelioma treatment decisions, make sure that immunotherapy is part of the discussion you have with your oncologist. And for more information, visit mesothelioma.net. You can learn more about treatment options and your legal options. You can also call 1-800-692-8608 or use the live chat feature on our website to speak directly to one of our patient advocates. As for me, remember to post any questions you have below, and I'll see you next time.